life itself wouldn't be as grand as it is now without community health centers in your community. I was PTO president at my children's high school, and one of the first in South Carolina to have a school-based clinic. And the superintendent asked me, he said, Yvonne, we'd like for you to serve on the board of directors for the community health center. Okay, when I first got involved with the health center, I experienced so many different ways of improvement for my community. I mean, we saw lower teenage pregnancy numbers go down, STDs, it was just all positive things. And I'd like to tell the story about the 5-year-old little girl that was getting ready to be evaluated by the school district, simply because she was not ready for the first grade. And lo and behold, the reason why she was not able to perform on a certain level, she couldn't see. Our optical department did a thorough examination, got her some cute little glasses, and now she's a thriving young lady, and I'd really like to know what she's doing today and all. But it's things like that that makes the difference in your community.
What was important for you about becoming an advocate who felt confident sharing your story?
First of all, I always identify myself as a patient before anything, okay? And I had a chance and opportunity to visit other states to look at their health centers, and I'm thinking, this is so awesome. You know, during our Hill visit, we were at P&I. So my thing is that what can we do to bring new brick and mortar buildings to patients in rural South Carolina that are in your jurisdiction? And the conversation went from there, and that was when I got the opportunity to travel to DC to do a congressional testimony to tell the story about rural areas in South Carolina that were deprived of medical attention regardless to whether you have means to pay. Once I did that congressional testimony, I was never more uncomfortable ever to tell. I love Community Health Center. I'm a patient. Let me tell you my story, where it makes a difference. But the CEO and I together got out there and we sold the story about the services. We were collaborating with the public school, with churches, anybody, state organizations as well as community organizations, the local fire department, the prison system, and the list goes on and on, Community health centers are providing you with that kind of care. And that's what drives me. What wasn't available to me when I was growing up, I vowed to make sure that little girls and little boys, and irregardless to whether they look like me or not, they don't have to go through and tackle the barriers of not having access to the quality of care as I did. So when I see that happening, that brings the joy to my spirit.